How to treat and cure ear infections. Understanding ear infections, diagnosis and treatment. If you or your child has an earache that is accompanied, in some cases, by a stuffy or runny nose and a sore throat and fever, it is likely that the ear pain is due to an ear infection. Your doctor will examine the eardrum with an instrument called an otoscope for signs of infection, not an easy task if the patient is a fussy infant. The doctor may also check for blockage or filling of the middle ear using a pneumatic otoscope, which blows a little air at the eardrum. This air should cause the eardrum to move a little back and forth. If fluid is present, the eardrum will not move as readily. Another test for ear infections is tympanometry, which uses sound and air pressure to check for fluid in the middle ear. If needed, an audiologist will perform a hearing test to determine if there is hearing loss. On rare occasions, when the person is quite ill, a doctor may make an opening in the eardrum, draw out a sample of fluid from the middle ear to culture the sample in a lab. This more extreme measure is usually used only for serious or particularly stubborn infections. The treatments for ear infections. The goal of treatment for most doctors is to rid the middle ear of infection before more serious complications set in. Treatment usually involves eliminating the causes of the ear infection and killing any invading bacteria in the eustachian tube. Medicine for ear infections. An ear infection is often caused by a virus, in which case the only relief doctors can offer is treatment of the symptoms. To ease the pain of an ear infection, your doctor may recommend a pain reliever, typically acetaminophen or ibuprofen, which also helps reduce a fever. Aspirin should be avoided in children because of the threat of Reye's syndrome. Pain can also be reduced by using gentle heat from a heating pad, but be very careful when using heating pads with children. Sometimes, it is difficult for your doctor to tell with an otoscope alone if the ear infection is caused by a virus or bacteria, so deciding on a proper course of treatment isn't always easy. A debate over using antibiotics, bacteria-killing drugs, to treat middle ear infections arose in the 1990s as more bacteria became resistant to antibiotics. Some doctors initially treat only the symptoms of an ear infection, without antibiotics, a response that has been supported by several studies. But many doctors, particularly in the US, are concerned that without antibiotics, bacteria lurking inside the middle ear can grow out of control, possibly causing hearing loss or mastoiditis. After all, they point out, these complications have become rare, largely as a result of antibiotic therapy. To be on the safe side, many American doctors treat all ear infections as if bacteria are present. Amoxicillin is the antibiotic of choice for treating bacterial ear infections. The drug is highly effective. A single course of amoxicillin can usually knock out an ear infection in 7 to 10 days, at little cost. Whatever their origin, amoxicillin-resistant bacteria have shown up in a number of communities, leading many doctors to prescribe other antibiotics for ear infections. If an ear infection causes serious complications or if fluid remains in the ear for more than 3 months, physicians may suggest myringotomy with tube insertion surgery to eliminate infection or drain the middle ear. Because not enough air is coming through the eustachian tube to ventilate and dry out the middle ear, a little tube, less than ½ an inch long, is placed into the eardrum. The tube, which will usually fall out on its own in about a year, keeps a hole open in the eardrum so that air can get into the middle ear space and dry it out. A ventilation tube reduces pain, improves hearing, and cuts down on the number of infections your child may have. This procedure rarely leads to infection or scarring and usually provides long-term results. If after the tubes come out the ear infections return, it means your child hasn't outgrown the problem and a second set of tubes may be recommended. This time, an adenoidectomy surgery to remove the adenoids will also be suggested in an attempt to unblock the eustachian tube as much as possible, and to avoid inserting a third set of tubes. Tonsillectomy is generally not considered helpful for recurrent ear infections and is not usually recommended. Home remedies for ear infections. You can provide a great deal of ear infection symptom relief at home. Try these tips. Many find that warmth, perhaps from a warm compress, brings comfort. Steam inhalations may also help, but take care not to burn yourself. Protect your eye area, as well. If you bottle feed your baby, make sure the baby is held in a relatively upright position. Never put your baby to bed with the bottle, and try to take your baby off of the bottle as soon as your child's physician feels the child is ready. In older children or adults, gargling with salt water helps soothe an aggravated throat and may help clear the eustachian tubes. Holding your head erect can help drain your middle ear. Any smokers should refrain from smoking inside the house or anywhere around your child. A wait-and-see approach. Symptoms of ear infections usually improve within the first couple of days, and most infections clear up on their own within 1 to 2 weeks without any treatment. Managing pain. Your doctor will advise you on treatments to lessen pain from an ear infection. These may include the following. A warm compress. Placing a warm, moist washcloth over the affected ear may lessen pain. Pain medication. Use the drugs as directed on the label. Use caution when giving aspirin to children or teenagers. Children and teenagers recovering from chickenpox or flu-like symptoms should never take aspirin because aspirin has been linked with Reye's syndrome. Talk to your doctor if you have concerns. Antibiotic therapy. After an initial observation period, your doctor may recommend antibiotic treatment for an ear infection in the following situations. Children 6 months and older with moderate to severe ear pain in one or both ears for at least 48 hours or a temperature of 102.2 F, 39 C, or higher. Children 6 to 23 months with mild inner ear pain in one or both ears for less than 48 hours and a temperature less than 102.2 F, 39 C. Children 24 months and older with mild inner ear pain in one or both ears for less than 48 hours and a temperature less than 102.2 F, 39 C. Children younger than 6 months of age with confirmed acute otitis media are more likely to be treated with antibiotics without the initial observational waiting time. Even after symptoms have improved, be sure to use all of the antibiotic as directed. Failing to do so can result in recurring infection and resistance of bacteria to antibiotic medications. Talk to your doctor or pharmacist about what to do if you accidentally skip a dose. Ear tubes. Ear tubes, tympanostomy tubes. If your child has recurrent otitis media or otitis media with effusion, your doctor may recommend a procedure to drain fluid from the middle ear. Otitis media is defined as 3 episodes of infection in 6 months or 4 episodes of infection in a year with at least one occurring in the past 6 months. Otitis media with effusion is persistent fluid buildup in the ear after an infection has cleared up or in the absence of any infection. During an outpatient surgical procedure called a myringotomy, a surgeon creates a tiny hole in the eardrum that enables him or her to suction fluids out of the middle ear. A tiny tube, tympanostomy tube, is placed in the opening to help ventilate the middle ear and prevent the accumulation of more fluids. Some tubes are intended to stay in place for 6 months to a year and then fall out on their own. Other tubes are designed to stay in longer and may need to be surgically removed. The eardrum usually closes up again after the tube falls out or is removed. Treatment for chronic suppurative otitis media. Chronic infection that results in perforation of the eardrum. Chronic suppurative otitis media is difficult to treat. It's often treated with antibiotics administered as drops. You'll receive instructions on how to suction fluids out through the ear canal before administering drops. Monitoring. Children with frequent or persistent infections or with persistent fluid in the middle ear will need to be monitored closely. Talk to your doctor about how often you should schedule follow-up appointments. Your doctor may recommend regular hearing and language tests.